Recording started. Good morning, everybody. Thank you so much for joining us today for our April edition of the IHCP Live Monthly Town Hall. I am Elizabeth Killian, Provider Relations Manager here at OMPP, and I am with my colleague
Trevor Road. I'm Provider Relations Specialist with OMPP.
And let's take a look at our agenda for today. We previously heard on our March edition of the monthly town hall that providers wanted some more information about Package E and Package B. So we're going to take a few minutes to go over those packages and what benefits are covered and who is covered under those today. Then we're going to take a look at some of the bulletins that were published throughout March and April and provide some specific information about those. Of course, we're going to go over helpful resources for all of our Indiana Medicaid providers, and then, of course, the time for questions. And also, if you have suggestions for our future town halls, we would love to hear what else you would like to learn about.
So I want to start today by talking about Package E and emergency services only coverage. So this is the topic we've been hearing that providers would like us to go over. So we're going to go through a few slides here, take a few minutes to go through this. So emergency services only is defined as a medical condition manifesting itself by acute symptoms of sufficient severity, including severe pain, such that a prudent layperson who possesses an average knowledge of health and medicine could reasonably expect the absence of immediate medical attention to result in the following: placing the health of the individual, or with respect to a pregnant woman, the health of the woman or her unborn child, in serious jeopardy, serious impairment to bodily functions, or serious dysfunction of any bodily organ or part. This can all be found in 405 IAC and in the United States Code as well.
Additionally, emergency service coverage includes the coverage of the unscheduled, episodic, or irregular services provided to members who require immediate medical attention and or a service provided to a member after the sudden onset of an emergency medical condition. So that obviously means your standard preventative care is not covered, but just like Trevor said, if it is an event where a layperson could indicate that not getting care immediately would result in serious harm, that is generally covered. And then, of course, if there is immediate follow-up care to that onset of that condition, that is also covered. For example, if a member goes into the emergency room and is moved inpatient for the immediate treatment of that condition, that inpatient stay will be covered as well.
So moving on to the next slide, we wanted to take a minute to go over what Package E and Package B are. So as you can see with Package E, the benefits are limited to services that meet emergency criteria. There is also coverage for pregnant women within Package E. These services include labor and delivery. Package B is essentially known as ESO coverage with pregnancy coverage. Package B has the same benefits as Package E, but it also includes prenatal, delivery, and postpartum services.
And then, of course, we want to discuss who is covered or who qualifies for ESO Medicaid. Undocumented immigrants, temporary visitors, and work visa or student visa holders are eligible for coverage of emergency services only, no matter how long they have been present in the United States. Lawful permanent residents, or what we may generally call green card holders, that arrived after August 22nd, 1996, must hold that status for 5 years before they will be eligible for full benefits. I'm going to skip to the fourth bullet point. While they're awaiting that 5-year period, they are eligible to receive Package B, those lawful permanent residents, but undocumented members are covered for the emergencies and labor and delivery only under Package E. Refugees, asylees, victims of trafficking or abuse, and certain veterans and their families can receive full Medicaid. You definitely want to check with the Division of Family Resources on that and exactly who's available. Refugees and asylees from different areas of the world are eligible for different levels of benefits.
So as Elizabeth said on the last slide, qualification can be broken down by citizenship. Qualified non-citizen status requires the member to have documentation of immigration status, while on the non-qualified status side, it does not require that documentation. Members that do not have documentation can attest to immigration status and will be given a reasonable opportunity period where they're given 95 days to provide documentation. Identity verification is required to qualify for both. SAVE is required for qualified status unless they are electronically verified, while with non-qualified members, SAVE is not required. And finally, refugees, asylees, victims of trafficking or abuse, and certain veterans and their families have qualified immigration status and can receive full Medicaid.
And then continuing on with what is required to qualify for Package B and Package E, the applicant or member must meet the general eligibility requirements. So that means both the financial requirements and the non-financial requirements, and residency, which generally means that they live in Indiana. And then financially, of course, they have to generally be financially eligible for Medicaid in order to receive coverage. For Package B, of course, as we've mentioned, they have to have that lawful permanent resident or green card status. They also generally have to be eligible for Package E and either be pregnant or within a 60-day postpartum period. For Package E, that lawful permanent resident requirement is not in place, and they can be a non-qualified or non-citizen or undocumented. The note here at the bottom, there is a change coming up in mid-2025, or we expect it to be implemented in mid-2025, that would give full coverage without a waiting period, without that 5 years, to qualified immigrants who are children under age 19 for CHIP or children under age 21 for Medicaid, and 12 months pregnant or postpartum coverage as well. But that is something that is upcoming. Much more details on that to come, but just know that that is something that's changing.
So there are some other eligibility requirements for all Medicaid that we do want to go through as well. There are financial requirements, which can include wages and earned or not earned income, and non-financial, which citizenship and or immigration status. The applicants may not attest to citizenship or social security numbers. They must meet all non-citizenship requirements for the category that they're being considered in. And I do want to note also that applications can be denied for being over the income limit or if insufficient documentation is given to determine eligibility. Once Medicaid is authorized for a pregnant member, the coverage can only be closed if the member moves out of state in the event of death or voluntarily withdrawal until 60 days after the end of the pregnancy.
And then one of our, I'm sure, big concerns specifically for our members who would qualify for this, but also for providers, is do we report our members who have Package E to the U.S. Citizenship and Immigration Service? And no, we do not. So members who or potential members who are undocumented do not have to worry about being, turned into the U.S. Citizenship and Immigration Service and having any sort of consequences based on their undocumented status by receiving Medicaid benefits. So that is something that we definitely want to assure our members about. Also, sometimes either in filling out the application or when the application is processed by the DFR, there are errors on either side, the application or the processing, that might give an individual full coverage when they are not actually eligible for that full coverage based on their immigration status. If that happens, there is no consequence to the member. They are not required to repay any of the benefits that they received unless they are prosecuted and found to have done this intentionally. So of course, if it's just legitimately just an error on either side, we are not going to prosecute them. There's going to not be any consequences. We don't want members to be afraid to apply, or potential members to be afraid to apply based on, something that may happen. We're always going to give them the benefit of the doubt unless we can prove that they actually did something intentionally to commit fraud.
So as you can see on this slide, there's a copy of a Medicaid ESO member card. So on this card, you will find the member's identification number and date of birth. If the card is lost or damaged, members should contact the DFR to replace the card. Any questions about specific benefits can be answered by member services, who can be reached by the phone number on the back of the card.
And moving on to what is covered, again, we mentioned at the very beginning, it's overall those emergency layperson would determine that they need treatment immediately. However, for both Package E and Package E, any service must be determined by the provider to meet the criteria. So Package B, it would be pregnancy related. Package E is generally an emergency and must be submitted with the proper indicators on the claim to be covered. So this is something that we actually hear a lot from providers, that a member has Package E and the claim is still denied as if the member doesn't have appropriate coverage. This might get a little in the weeds if you're not the biller in your office, but at the claim header level, there is an indicator, yes, this was an emergency, and on every detail line of the claim, there's also an emergency indicator. You want to say why for yes, this was an emergency. That will help the claims to process correctly. You definitely want to take a look at the emergency services provider reference module. We'll have a link to all of the modules later on in our presentation, and also the claim submission and processing module. Neither Package B or Package E cover non-emergency transportation. However, emergency transportation would be covered. And just like the majority of our other benefit plans, if the members or applicants, they can receive retroactive emergency services only benefits up to 90 days prior to the application date if the member meets eligibility criteria during that month, those months as well. So if the member were to apply or be given benefits as of March 1st, but they were eligible, met all the criteria back to January 1st, we could backdate that coverage just like we do for most of our other plans, except for HIP, which is always going forward. Sorry, I forgot other bullet points. Package E and Package B are fee-for-service, and any Medicaid provider can provide coverage. So these members will not be assigned to any of our managed care entities. They will have that traditional fee-for-service coverage. And again, there's no special enrollment or any special boxes to tick for providers to be eligible to provide coverage to these members. Any enrolled provider can provide coverage. Of course, we know that sometimes providers are not taking new patients or whatever the case may be. So each individual provider may not be providing services for Package E members, but there's no special process. Of course, emergencies often can happen out of the state. We don't plan for an emergency ever to happen in our lives. The emergency itself would still be covered under Package B or Package E. If there is any additional follow-up care that is needed, we would expect that member, if possible, to travel back to Indiana for any additional care. But the emergency itself would be covered unless, of course, that out-of-state provider is also an Indiana Medicaid provider. We have our bordering counties and such where they are enrolled.
So I just wanted to take a step back for a second to my previous slide. So as I previously mentioned, members can reach out to member services for any specific benefit questions. And here is provided a picture of the back of the card that we previously mentioned. And here you can find the phone number to reach member services as well as the managed care entities phone numbers as well. So we now want to highlight a few bulletins from the last month or so, and we want to start off with BT 2024-29, where the IHCP clarified the HIP rate equalization project. So in this short bulletin, the IHCP wanted to clarify some language that was previously included in the previous bulletin, which was BT 2023-149. So there was some confusion around the following statement. The IHCP professional fee schedule will be aligned with 100% of Medicare rates. Rates for Hoosier HealthWise, Hoosier Care Connect, and fee-for-service programs are all being increased to 100% of Medicare rates to align with HIP rates. The HIP rates for 2024 will remain the same as the rates paid in 2023. This bulletin clarifies that the last sentence, which can be found in the bulletin, only applies to professional services with a Medicare rate. Services without a Medicare rate are set to pay according to the established 2024 rate within the IHCP professional fee schedule.
And next, we would like to highlight BT 2024-33. This bulletin announces the expansion of the state uniform preferred drug list to include drugs reimbursed through medical benefits. Previously, BT 2022-70 announced that as of July 1st, 2023, all managed care entities and fee-for-service would be aligned in the coverage of drugs reimbursed through the preferred drug list. So that means that step therapy, utilization edits, and prior authorization criteria for drugs on the fee-for-service preferred drug list would be the same between managed care entities and fee-for-service. This bulletin announced that effective April 1st, 2024, that is expanded to include physician-administered drugs listed on the state uniform preferred drug list that are reimbursed through managed care medical benefits. And the coverage for those through the managed care entities must also align with the fee-for-service preferred drug list for step therapy edits and criteria. MCEs are permitted to direct reimbursement of these drugs through either the pharmacy benefit or the medical benefit, but regardless of which way they reimburse it, it does have to align with the state uniform preferred drug list.
Yeah, so the next bulletin we wanted to highlight is BT 2024-39. So in this bulletin, the IHCP provided instruction for the enteral and parenteral nutrition DME information form. So this form must be submitted with PA requests for enteral and parenteral nutrition products. However, a physician's signature is not required on the DME information form. The form states that it should be signed by the supplier of the product, and the physician's signed order for the enteral or parenteral nutrition products must be included along with the DME information form as part of the PA process, PA request. A link to that form as well as the DME provider reference module can be found within the bulletin.
And I know that that is a form that has caused confusion for our DME providers for quite some time, so I'm glad we could finally make a change to that. Next, we are going to highlight BT 2024-38, which covers our IHCP Roadshow. And our Roadshow is starting next week, April 30th. In Mishawaka, and then additional dates throughout May and finishing up in early June in Richmond. I do want to just go ahead and acknowledge that we realize that there is a bit of a geographical hole in the Fort Wayne, Northeast Indiana area. We tried our absolute best to be able to confirm a location up in that area, and we weren't able to do so this year. I know that we've normally been able to go to that area. Hopefully providers can make it to one of our other locations. Again, we realize that that's going to mean traveling a bit further than you probably are used to or may want to. And if you're not able to travel, all of our presentations from the day will be on the IHCP provider website, so hopefully you can review those if you're not able to make it to one of our locations. We do have a pretty good lead on a location in the Fort Wayne area for next year already, so hopefully we will not have, again, that geographical hole for you. But again, just want to acknowledge we are aware of it, we apologize, and we are doing our best to make sure that that's not the case for next year. But on those roadshow locations, we are expanding the content this year to include our pathways, managed care entities. So you'll see that the day is going to be divided into a morning session that's dedicated to the pathways program. You'll hear from OMPP and all of the pathways managed care entities. And then in the afternoon, we're going to focus on our existing programs, or our fee-for-service, Medicaid, HIP, Hoosier HealthWise, and Hoosier Care Connect. We've also realized that a lot of providers are signing up for both sessions throughout the day, which is great. And we're really excited to be able to meet all of you in person and provide that really important content for you. And hopefully you'll enjoy yourselves, and we'll get to say hi to, put some names with faces.
Yeah, so now we want to take a minute to go through some available resources for you. So each MCE and Gatewell Technologies has representatives assigned to each area of the state. They are the provider relations consultants, and they should be one of your first points of contact when you have questions. Our provider relations materials can be found on the provider section of the Indiana Medicaid website. These materials include our bulletins and provider reference modules, as well as our IHCP quick hits, which are little snippet videos of specific topics that have been requested for us to go over, or just a topic we think is important for providers to watch a video to see more information on. So this section will keep you up to date on all of the new information coming from the IHCP. And finally, on this slide, I want to mention our webinars. Still within the provider section, the provider education tab holds all of our past IHCP live webinars. While this is only our second IHCP live monthly town hall since our format changed, you can find our first monthly town hall along with previous IHCP live monthly policy update webinars on this portion of our website. And you can also find webinars that we've held for special topics here too. So I wanted to slightly backtrack for a moment to show the provider relations consultant map. So here you can see the state of Indiana broken into 5 regions, with each having a designated field consultant and how to reach them. And for those out-of-state providers, we have you covered as well. So listed here are our out-of-state provider relations consultants, along with their contact information as well. And again, you can find this information on the Indiana Medicaid website in the provider section.
And we want to thank you all for joining us today for this edition of the IHCP Live Monthly Town Hall. We are absolutely open to your feedback for future webinars. And if you have questions about anything we have covered today, we're also happy to answer those questions. We may need to take some questions back if we don't have the availability to answer that immediately. But we're taking a look at the chat, and please let us know if you have any questions. Maybe we've done such a good job, Trevor, they have nothing for us.
I sure hope that's the case.
Again, if you don't have questions specifically, if you have ideas for future webinars, please feel free to put those in the chat as well. Our colleagues, Jenny and Sarah, will be doing a webinar in early June. We're going to actually skip May. And they are eager to provide information about topics that are important to our providers. Oh, did you? I did want to say that in addition to, like I said, we're skipping May. That's not actually entirely the case. Our team is not going to be presenting because Michael Cook is going to be doing a webinar about electronic visit verification. And then our team is also going to be doing a webinar about the changes to the waiver certification process. That is going to be starting in conjunction with the transition to pathways. So many more opportunities to still hear from us, but just not in this particular format. I see a question/comment here. We are a hospital who sees a lot of Package E members that are rejected due to not being a true emergency. Can we bill those members, and should we still get paid for the triage rate? I would recommend that you double check in the provider enrollment manual, provider reference module, I should say, which is kind of a funky place for it to be housed. But right towards the end of the module, there are instructions about specifically when a member can be billed. I would recommend just double checking as you're submitting those claims that the diagnosis codes are most specific and applicable to the scenario that you saw the member. Again, that those emergency indicators are on the header and the detail level of the claim. My colleague did go ahead and put that module in the chat there for you. But I guess I would just say I would urge you to exhaust all of your options for allowing Indiana Medicaid to bill you to reimburse you for those services before you before you take the step of billing the member. But review, like, if it's on like the third to last page in that module. Page 114. Thank you, Jenny. And then as far as I'm not entirely, I think you mean billing Medicaid for the triage rate. That piece we may have to take back. I am not very familiar with triage billing off the top of my head. I don't want to provide any incorrect information. Angie, if you would like to send that question to the provider relations inbox, we can take a look at that a little bit further, make sure we provide the right answer for you. We'll hang out for just a couple more moments to see if there's any other questions. And again, Jenny's on it and put that provider relations inbox email address in the chat there for you, Angie. I think we're just going to give it maybe like 1 or 2 more minutes just to make sure nobody's, sitting by their keyboard waiting to type that question. Oh. Okay. Well, we're not seeing any other questions. Thank you all so much for joining us today. I hope that you learned a lot about Package E. Oh, just as we thought that. Can we discuss in the future any problems we're having with Gainwell FSSA crossover? Can we get someone from KeyPro? We probably can get somebody from Essentra. I'm not sure, they are not located here in Indiana or here in Indianapolis, so we might not be able to be on camera, but we can absolutely have someone join us. Leanne, if you could email us and tell us a bit more what you mean by Gainwell FSSA. I'm not, do you mean like what is Gainwell responsible for and what is FSSA responsible for? Is that what you're getting to? Not seeing Leanne typing currently, but Leanne, if you could email us, I know you have our oh, okay, perfect. Yes, I think that would be a great topic. We work, Gainwell and FSSA work really closely together, but you're right, there are some things that we're responsible for and things that they are responsible for. So we can definitely take that back. And I can't guarantee you that will be the June topic, but I think that's certainly one we can focus on in the future. So again, thank you all. If you think of anything in the future, that provider relations inbox is there in the chat, and we would love for you to send us some recommendations. We always want to provide the content that our providers are looking for. Hopefully we will see you at one of our roadshow locations. Again, let me tell you that bulletin number. BT 2024-38 for registration for the seminar. So hopefully registration for the road show. Hopefully we will see you at one of those locations. Thank you so much for joining us today, everyone. Have a great rest of your day.